Clinical research with economically disadvantaged populations. Clinical research involving economically disadvantaged populations is an important and complex area of study. It is important to ensure that clinical trials and research studies are conducted in a fair and ethical manner, with the inclusion of diverse populations, including those who may be economically disadvantaged. Here are 10 considerations and challenges related to conducting clinical research with economically disadvantaged populations. 1. Inclusion and representation. It is essential to include economically disadvantaged populations in clinical research to ensure that medical advancements benefit everyone. However, barriers such as limited access to healthcare, lack of awareness, and socioeconomic challenges can make it difficult for individuals from economically disadvantaged backgrounds to participate in clinical trials. Efforts should be made to actively recruit and engage these populations to ensure adequate representation. 2. Informed consent. Obtaining informed consent is a fundamental ethical requirement in clinical research. However, individuals from economically disadvantaged backgrounds may have lower health literacy levels or limited understanding of research procedures, which can affect their ability to provide truly informed consent. Researchers must take extra care to ensure that potential participants fully comprehend the study purpose, risks, benefits, and their rights before they decide to participate. 3. Access to healthcare. Economic disparities can impact access to healthcare services, including participation in clinical trials. Lack of insurance coverage, transportation challenges, and limited availability of medical facilities can create barriers for individuals from economically disadvantaged populations. Researchers should consider these factors when designing studies and take steps to minimize such barriers, such as providing transportation or conducting trials in accessible locations. 4. Ethical considerations. Researchers must ensure that the risks and benefits of participation are fairly distributed among all participants, regardless of their economic status. They should also be mindful of any potential exploitation or coercion, ensuring that vulnerable individuals are protected and their rights respected throughout the research process. 5. Socioeconomic factors. Economic disparities can significantly impact health outcomes and may lead to differences in disease prevalence, treatment response, and overall health status. Researchers should consider these socioeconomic factors when analyzing study results and interpreting the implications for economically disadvantaged populations. 6. Community engagement. Engaging with the local communities and stakeholders is crucial in conducting research with economically disadvantaged populations. Collaborating with community organizations, healthcare providers, and community leaders can help build trust, address concerns, and ensure that research efforts are aligned with the needs and values of the population being studied. 7. Financial considerations. Economic challenges may restrict the ability of individuals from economically disadvantaged populations to afford the costs associated with participating in clinical research, such as travel expenses or lost wages due to time off work. Researchers should explore strategies to minimize financial barriers, such as providing reimbursement for expenses or collaborating with healthcare systems to cover certain costs. 8. Retention and follow-up. Retaining participants from economically disadvantaged populations throughout the duration of a clinical trial can be challenging due to various factors, such as unstable living situations, lack of reliable contact information, or competing priorities. Researchers should implement strategies to maintain regular communication, provide reminders, and offer flexible options for study visits to improve participant retention and follow-up. 9. Data interpretation and generalizability. Economic disparities can influence the generalizability of study findings. It is important for researchers to consider how socioeconomic factors may impact the results and carefully interpret the data within the context of the population being studied. Additionally, efforts should be made to disseminate research findings to relevant stakeholders, including policymakers, to advocate for addressing health disparities in economically disadvantaged populations. 10. Benefit sharing. Researchers should consider how the knowledge gained from clinical research can benefit the communities involved. This can include collaborating with local healthcare providers to improve access to treatments or sharing research findings with community organizations to support health education and outreach initiatives. Overall, conducting clinical research with economically disadvantaged populations requires sensitivity, awareness of potential challenges, and proactive measures to promote inclusivity, informed consent, and equitable participation. It is important to prioritize diversity and ensure that the benefits of medical research reach all segments of society.